Hello everyone, I am Dr. R. Suneel, consultant hand and wrist surgeon at Medicover Hospitals, High Tech City. I am an orthopedic surgeon with specialized interest in hand and wrist disorders. So today I'll be describing a few conditions related to painful wrist, which is a common complaint which we see in our OPD. So whenever a patient comes with a wrist pain, we try to exclude the causes like any history of injury or any arthritis or any other inflammatory condition, and then we particularly point out to a particular area of location and then further diagnose the illness. So if we see the common causes of pain around the wrist, it can be related to any fracture or any tendinitis or any other tumorous conditions or any arthritis. So of all these conditions, the commonest ones which we see are the tendinitis, and of all the tendinitis, the first compartment tendinitis, which is usually located here, that's what we call it as a dih-kwer-VAINS tenosynovitis, also called as the first compartment tenosynovitis. So here exactly the patient presents with pain at the base of the thumb or on the outer side of the wrist, and it worsens with work, and it's commonly seen in women of household work and in the elderly age group. It's slightly less frequent in male and in children. So coming to the causes, what are the common causes for dih-kwer-VAINS tenosynovitis? It is related to thickening of the tendon sheath or inflammation, or there is reduced space for tendon gliding in its anatomical location, and it can be because of various other causes like repeated overactivity, like regular household work or office work or laborious work can cause in thickening of this tendon sheath and aggravation of pain. Apart from these, other causes can be any inflammatory arthritis, diabetic patients, or post-pregnancy, especially women who have recovered from pregnancy because of fluid accumulation in the body can present with again the same symptoms of wrist pain. So when any patient comes with this kind of history and clinical features, the first thing which we ask them is how long it has been present and how badly is it affecting their activities of daily life. Any symptom persisting more than 6 weeks or affecting their office job or work at home is significant, and we proceed with further evaluation of these patients. So whenever when a patient comes and sits in front of us, particular point for tenderness is here. When we press here, they feel it quite tender, and we can feel a swelling over there, which is actually a thickened sheath. Some patient also have a cyst over there, and whenever we try to bend the wrist or bend the thumb, it becomes the pain becomes out of control and they start jumping from their seat. So these are classical findings of dih-kwer-VAINS tenosynovitis. And for coming to the evaluation, we get a routine X-ray to rule out any bony problem. Sometimes if it's a chronic problem or any old fractures can show signs in the X-rays. Other causes like diabetes and thyroid issues and any inflammatory arthritis are all ruled out with regular blood tests if you have suspicion for that. And how do we manage this? If the patient's symptoms are mild, short onset, not affecting their lifestyle much, we usually advise rest, splints, ice application and medications, especially anti-inflammatory medications. About 50% of patients with mild symptoms usually settle down with this first line treatment, and those patients who don't respond to the first line treatment or who have worsening of symptoms over time, we go for the second line of management, which is usually a steroid injection into the tendon sheath. So many patients have this question that is steroid safe? So whatever steroid we give, it's a local steroid and it doesn't have any systemic symptoms. It acts locally up to the point where it is given and it's not absorbed into the body. So there are no general symptoms or side effects of the steroid injection. It's 100% safe. So it's given only in patients who have their diabetic safe, and when there is no local sign of infection, we go ahead with this thing. So it's given under sterile conditions, so there is no risk of infection even after the steroid injection. So it's given by the doctor into the first compartment. So the effect of steroid lasts for about 5 to 6 months, and if the patient benefits from this steroid injection, he may additionally ask for another shot. So the maximum number of shots we give is 2. And we don't go beyond 2 because the efficacy of injections reduce with every further shot which we give. And if the patient is not relieved even with the steroid, or if he has relieved and he has exceeded the number of injections, or if the pain has disproportionately increased with significant thickening, then comes the picture of surgery. So we routinely advise surgeries. It's absolutely safe for indicated patients and it's done under local anesthesia. So even the anesthesia is given in that particular area, and it's there are no systemic side effects of this local anesthesia. So what exactly is done is that limited space which is there for the tendon to glide and the thickened sheath which is overlying it, we just cut the roof, which is called the dorsal compartment release, and once we release the roof of that tunnel, the tendon starts to glide as normal before, and it gives a immediate permanent relief for the patients. So some patients even after release also complain of this pain, which usually lasts for about 2 to 3 days, and it settles down with time. But the problem with this procedure is it has to be done perfectly, because there are some anatomical variations in the tunnels, like you may miss a particular tendon or you may injure a nerve which is in close proximity, which is a radial sensory nerve. So as a hand surgeon, I would like to check for all the other anatomical variations, check that it is relieved sufficiently and the nerve is safe, and cosmetically also the scar will be very it's not usually seen in the wrist region. And the procedure is usually very last, it doesn't recur again, and the patient will be quite happy even after a surgical procedure. Please visit agileortho.in for further orthopedic related complaints, problems, issues, appointments, or any further discussion you want to have with your doctor. Thank you.